Hi, I've got a really interesting case for you today. It's a real simple condition, but one that can be very bothersome. This lady has the fourth toes on both feet. The fourth toe would be the one next to the small toe. Had an underlapping flap of skin that would go underneath the next toe, which is the third toe. And every time she would take a step, this would pinch. And so, of course, she was trying to run and be in good shape, but could not do that because every time she would run, they would get red, irritated, and form a blister where this tissue from the fourth toe was underlapping the third toe. So I went in and did what I call a toe tuck. And so you've heard of tummy tucks before. This is a toe tuck. So I hope you enjoyed this story about my toe tuck procedure. I'm Dr. Robert Parker with Parker Foot and Ankle and Neuropathy Care Center of Houston. I hope you enjoy this case.
So we're here with Melanie. Melanie, we did a little procedure for you that we call it a toe tuck. Would you mind describing what you had prior to this little procedure and how it was affecting your life, and then what here we're now, 4 weeks out? Yeah.
My third toe and my fourth toe on both feet were rubbing against each other when I walked, and on my fourth toe you could see a permanent pinched place where it didn't ever remove. It just stayed pinched and sore. And the more I walked, the worse it became. And I didn't think you could do anything for it because it's not like crossing over, it's just the skin. But this procedure has solved that. I walk like a mile a day so far and no problems at all.
And we did this how many weeks ago, was it?
We did it about 4 weeks ago.
5 weeks ago. There you go. Good. So then what she was describing is that, I'm a little bit shadowed here, but what she was describing is that this part of the fourth toe was hypertrophied and underlapping the fourth so that it was getting pinched. When she would walk, it was getting pinched here. And so what we did is what I call a toe tuck, where you take this part of the inside of the toe and wedge out a piece of skin and tissue, and the circumference now is normal. It's red now because it's just kind of sloughing where the incision, you can barely see the incision here right in that area. So I'm real happy with that. We call that a toe tuck instead of a tummy tuck. And this is the other one. We did both. Usually it's bilateral. So you can see the circumference of the toe looks natural like the other ones now. It's not underlapping with this flap of skin underneath it. Melanie, thank you so much. I appreciate you sharing that. Okay.
And these procedures are done in my minimally invasive outpatient center here, the office-based surgery center. Patients just have their local anesthetic and they have a Valium, something to relax them. No general anesthesia, no IVs. It's just very convenient. As you can see, I'm in the OR suite right now, and it's fully equipped to do these surgical procedures with my imaging. In the corner, you saw lasers that we give postoperatively to help people heal. That's therapeutic lasers, not surgical lasers. And then we have the imaging that you saw. And it's just very convenient for the patients. No hospitals necessary. And they're very happy to have these procedures done. It's very comfortable, and patients can listen to their music and relax while we do the procedures. Hope you enjoyed this story about my toe tuck procedure.